Welcome back to Living 808. Thanks to a new prescription drug law, folks with Medicare may qualify for even more savings this upcoming year. Martha Clopin of Get to Insurance joins us with all the details and gives us info on how you can get more savings on Medicare drugs in the upcoming year. Aloha.
Aloha.
And I love your outfit today.
Oh, thank you.
She is popping. I feel like we look cute. We're like kind of like cotton candy, the pink and blue.
Yes.
Okay, this is a really important topic and exciting for a lot of folks.
Yes.
So let's talk about the changes that are coming in 2024. What's new?
Yes, well, there was a law called the Inflation Reduction Act that passed, and this is going to give Medicare beneficiaries some additional savings on their prescription drugs in 2024.
Wonderful.
Yeah, and it's going to help them save on deductibles, premiums. So this, I've been singing this song, I get by with a little help from my friends, and I think it's so important that we're all aware of programs to help people save money on prescription drugs, and especially folks who have Medicare. They need the savings.
Yeah, and when do these savings start?
These savings start January 1st, 2024, so don't look for them tomorrow, but January 1st, 2024. But only 21% of people are even aware that these programs are available. So Centers for Medicare and Medicaid are working with partners like myself and making sure to get the word out to people to help them understand there are savings available. Now, there are some income requirements, but it's important that we know about these programs to help save people money.
Definitely. And let's talk about the program, Extra Help. How exactly does it help to lower the cost?
Yeah, the way that it helps to lower costs is because some Medicare prescription drug plans have deductibles. So a deductible is the amount you must pay first. So for some people, you know, recently I got a call about someone whose medication for their eyes, eye drops, were a few $100s. Wow. So this Extra Help program could bring that down to little of nothing or even zero. So it's very important to know what these prescription savings programs are to save money on your prescription drugs, because eye drops, you need that. So you want to have good vision so it can help save on prescription drugs.
And so is there anything that you have to do to get those savings? If you're already enrolled, do you need to reapply, or do you have to specifically say you want to be a part of this new program?
Yes, for some people, if they already qualify for state Medicaid or supplemental income, they will be automatically enrolled in the program. They don't have to do anything. But for, you know, only 21% of people who qualify take advantage. So that leaves a lot of people who still need to reach out to Social Security and complete an application. They can do it right on the phone. And for those folks, they'll get these new savings for January 1st.
Oh, exciting, exciting. I mean, everyone loves that word, right? Savings.
Yes.
So, but earlier you did mention there are some income requirements. So what are the both individual and family income limits to qualify?
Right. Now, it's going to sound low. 21,000, about 21,870 for individuals and a little bit higher for married couples. But I have a lot of folks I work with who are in their 80s and 90s, and their income is actually quite low because at the time they qualify for benefits, the incomes were a lot lower. So there are a lot of people who can be helped by this program. So any aunties, uncles, grandparents, you know, in their 80s and 90s. I even have 2 clients that are 100 years old.
Wow, love
so
it.
These are the people who can benefit. So that's why I say I get by with a little help from my friends. We need to start thinking about people who may have income in that 21,000 or below level, or couples a little bit higher. We should be thinking about helping our loved ones and our friends.
Definitely. And how can we help? How, you know, if people want to learn more information or if they want to apply, how do they do that?
It's simple. They can contact Social Security. There's a 1-800 number, 1-800-772-1213. And you know what I've been doing, Kelly? We actually expanded Get to Insurance, and we have more people that are helping people with these non-routine things that don't generate any commission, but we will actually make a phone call with you to frame the question so Social Security knows why you're calling, so you can see if you qualify for these programs. So we're still helping people access to affordable programs to help lower costs of healthcare.
Love that. The work you guys do is so great. I know you help so many folks in the community. So if people want to call, where do we go? Website, or what number do we call?
Well, they can go to our website, gettoinsurance.com, or they can call 1-800-800, nope, sorry, 1-808-230-3379.
808, not 800. Okay, one more time.
1-800-230-3379. That's my personal cell phone. And
808.
people are shocked when they call me at 808-230-3379. And they actually get me.
I know,
They
right?
actually
Okay,
get me.
Martha will answer your call, and we'll have that website on our website at kh12.com, where we'll also have her phone number to directly connect you with Martha. Thank you so much for joining us.
Thank you, Kelly, and happy birthday, belated birthday.
Thank you so much. And again, thank you for all that you do. We'll have all their info online.